Most strokes don't start with pain. They start with the face, a slight droop in the mouth, uneven eyes, or just a look that doesn't seem right. The scariest part? Millions over 60 miss these quiet warnings every day. A stroke warning can disappear in minutes, but if you catch it in time, you can stop brain damage before it begins. In this video, you'll learn the 4 facial signs of a stroke, backed by 6 months of research from leading hospitals in the US, Germany, and Japan. Don't scroll past, because in the next few minutes, you might learn the one thing that could save your life, or someone you love. Most people think of stroke as something sudden and dramatic, but in many cases it begins quietly, with small changes in the face that are easy to miss. These are the 4 early facial signs you need to know. Each of them may last just a few minutes, but noticing them in time can make all the difference. The first place to look is the forehead. 1. Unable to raise both eyebrows or frown evenly. It might seem like a small detail, but this is one of the most reliable indicators. If someone tries to raise their eyebrows or frown, and only one side of the forehead moves while the other stays flat, that's a major red flag. It means the brain is not sending signals properly to the facial muscles on that side. Unlike issues caused by nerve pressure or fatigue, stroke affects only one half of the face, leaving the other side perfectly normal. That contrast helps distinguish stroke from other conditions. The forehead may be overlooked, but it often speaks up first when the brain is in trouble. Think of it as the warning light on the dashboard. If it's not moving evenly, there's no time to wait. Now move down to the mouth. 2. Unable to move one side of the mouth when pressing lips or speaking. Ask the person to press their lips together or blow gently. If one side can't stay closed or air escapes more from one side, it's a clear sign that muscle control has been lost. That means one half of the brain isn't working properly. During a stroke, the ability to coordinate lips, cheeks, and tongue becomes impaired. The voice may sound slurred. Words may seem lazy or unclear. Sometimes it's mistaken for fatigue or even intoxication. Even simple words like pa or ba may come out unevenly. This sign can appear before more obvious symptoms, and it's one of the easiest to test. If you're with someone now, ask them to gently press their lips together. Watch both sides carefully. Next, look at the eyes and cheek. 3. Drooping eyelid or cheek. You may notice one eyelid looks lower than the other, or a cheek that seems saggy or lifeless. This isn't just tiredness, it's a loss of muscle control, and when it happens suddenly, stroke should be your first concern. The brain controls the opposite side of the face. So if the left side of the brain is in trouble, the right cheek or eye may stop responding. Often the person feels no pain, and sadly many people dismiss it as being tired or having a bad night's sleep. But when you see a face that looks off, even just a little, trust your instincts. That feeling of something's not right might be what saves a life. Finally, pay close attention to the smile. 4. Uneven smile. In a healthy smile, both sides of the mouth lift evenly, but when someone is having a stroke, one side may stay flat. That imbalance is a silent alarm. Each side of the brain controls the opposite side of the face. If one half of the brain doesn't get enough oxygen, the muscles on the other side shut down. The person might not feel anything unusual. They may still be talking, responding, even saying, "I'm fine," but their face tells a different story. If you've ever seen someone smile and thought it looked off, don't brush it off as awkwardness or age. That uneven expression could be the brain calling for help. All 4 of these signs, whether it's the forehead, lips, eye, or smile, can appear for just a few minutes, but if you ignore them, you might miss the only chance to prevent permanent damage. Statistics show that in 80% of strokes, the face shows clear warning signs within the first 10 minutes. Sadly, many people hesitate. They're unsure, they don't want to overreact, or they simply don't know what to look for. And by the time the symptoms move to the arm, leg, or speech center, millions of brain cells may already be lost. You don't need to wait for someone to collapse. You don't need to see paralysis or hear them slur. One uneven smile, one drooping eye, one strange expression. That can be enough. Act fast, because when it comes to stroke, the face often tells the story first, and time is everything. Why the face is the brain's first cry for help during a stroke. When it comes to stroke, the face is often the very first place to send a warning. That's not a coincidence, it's science. Once you understand why the face changes first, you'll never overlook those early signs again. We often hear about stroke symptoms like slurred speech, weakness in the arms, or trouble walking. But in many cases, the first clue shows up in the mirror: a mouth that won't lift, an eye that won't blink, a forehead that stays still. These subtle changes are actually loud alarms from the brain. Inside your brain, there's a small region near the surface responsible for facial control, your ability to smile, blink, frown, and speak. This region connects directly to the facial muscles through a short, vulnerable pathway. There's no backup system, so when a blood clot blocks oxygen to this area, even for a few minutes, the signal is cut off, and the face reacts instantly. That's why facial signs appear earlier than changes in the arms or legs. The limbs have longer nerve paths and alternative routes. The face doesn't. In fact, over 60% of strokes that involve blocked blood flow affect this specific region, according to research from the NIOH. One study from the American Heart Association found that in more than 70% of sudden stroke cases, the face was the first area to show symptoms. Emergency doctors agree. The sooner you recognize facial changes, the better the outcome. A delay of just 15 minutes can result in irreversible brain damage. The area of the brain that controls the face also helps us form words and express emotion. That's why a person having a mild stroke may still seem alert, but their speech is slightly slurred or their expression seems flat. Doctors sometimes call this the golden triangle of early stroke signs: a crooked smile, unclear speech, and a face that doesn't show emotion. Each of these signs means the brain is under threat, and every minute that passes without help can cost up to 1.9 million brain cells. Acting within the first 3 hours, the golden window, dramatically improves the chance of full recovery. However, not every facial change is a stroke. Bell's palsy, a harmless condition caused by nerve swelling, can mimic these signs. But there are key differences. Bell's palsy develops slowly, affects the entire side of the face, and usually doesn't affect speech or limb strength. Stroke, by contrast, comes on suddenly, often affects just the lower face, and may include trouble speaking or weakness in an arm or leg. If you're unsure, always treat it as a stroke. Quick action is far better than regret. The problem is, many people, especially older adults, misread these signs. A crooked smile, just tired. A droopy cheek, bad night's sleep, a slow blink. Maybe it's just nerves. And so, they wait. Waiting is the biggest mistake. In the first 5 minutes, you may see only slight facial changes. By 15 minutes, speech becomes harder and confusion sets in. After 30 minutes, limb control can be lost, and permanent damage or coma may follow. All it takes is a few seconds of attention. Look at the face. Does the mouth lift evenly? Do both eyes blink? Is the cheek firm? Does the forehead wrinkle? These 4 points, mouth, cheek, eye, and forehead, can reveal more than any test. You don't need a stethoscope or a blood pressure cuff, just your eyes. If someone is still speaking, but their face looks different, don't assume they're fine. That could be the only moment you have to step in. The face gives us the fastest signal of stroke, and yet many people over 60 miss it. Why? The next part will explain the 10 most common reasons seniors ignore or misread facial stroke signs, and how knowing them can help you stay one step ahead. 1. Mistaken belief that stroke must be painful to be serious. One of the most dangerous misunderstandings is the idea that a stroke must come with intense pain. Many older adults think if there's no pounding headache, no chest pain, or no dramatic collapse, then it can't be serious. But that assumption is exactly what delays treatment. In reality, most strokes, especially ischemic strokes, happen quietly. There's no pain, no warning bells. According to the American Stroke Association, up to 65% of ischemic strokes occur without pain. The damage happens silently while the person continues their day, unaware their brain is starving for oxygen. A 74-year-old man in California saw that his right eye opened slower than the left and that his mouth looked slightly uneven. But because he felt no pain, he ignored it and went for a walk. An hour later, he collapsed. He had lost the opportunity for clot-busting medication. If he had understood that stroke often doesn't hurt, his story might have ended very differently. This brings us to another reason strokes are so often missed. 2. The habit of staying quiet in the maybe tomorrow mindset. Many older adults grew up in a time when complaining was frowned upon and enduring hardship was considered strength. That mindset, while admirable in many aspects of life, can become dangerous in the face of stroke. When someone notices a mild slur in speech or a crooked smile, they may tell themselves, maybe I slept wrong, or maybe I'll feel better tomorrow. Unfortunately, stroke doesn't wait. In those crucial first few hours, millions of brain cells are dying every minute. According to the Cleveland Clinic, nearly 40% of older adults who experienced early stroke signs chose to wait and see rather than call for help immediately. More than half of them missed the window for the most effective treatment. What makes this even worse is when the warning signs are brushed off as simply part of getting older. 3. Blaming it on age or temporary tiredness. It's easy to blame changes in the face or speech on normal aging. I probably just didn't sleep well. Maybe it's dehydration. This happens when you're in your 60s. These thoughts are common and dangerous. The reality is, stroke doesn't always announce itself with dramatic symptoms. One side of the face might feel heavier, the mouth may droop slightly, or speech may feel just a bit off. These subtle signs can be easy to explain away. But these aren't things to ignore. According to the CDC, nearly 30% of older adults who experienced early stroke signs thought it was just normal fatigue or stress. That misjudgment often leads to a delay in getting medical attention and permanent damage. And sometimes people don't even feel anything is wrong. 4. They feel fine, even when signs are already there. This is what makes stroke so tricky. A person can be having a stroke and still feel perfectly fine. They may be standing, walking, talking, completely unaware that part of their brain is no longer receiving blood. Thomas, a 68-year-old from Texas, had a slightly crooked smile and was speaking slower after an afternoon of yard work. His wife noticed, but he dismissed it as just the wind. 2 hours later, he lost the ability to speak entirely. Feeling okay doesn't mean everything is okay. With stroke, the symptoms can be ahead of the feeling. If something seems off, especially in the face, it's time to act. And for those who live alone, catching these changes becomes even harder. 5. No one around to observe from the outside. Roughly 27% of Americans over 60 live alone. That number is even higher after age 75. Living independently has many benefits, but it also brings a serious risk. There's no one to notice the warning signs. A stroke often affects the face first. A drooping eye, a slack mouth, slurred words. These changes are best noticed by someone else. If you're alone, they can easily go undetected. In one case, a 78-year-old woman in Illinois didn't realize her face had changed. She called 911 5 hours later because of numbness in her hand. By the time paramedics arrived, the stroke had already progressed. That sense of silence isn't just physical, it's also emotional. 6. They are afraid of bothering their children or neighbors. Even when older adults notice something might be wrong, many hesitate to reach out. They fear being a burden, causing unnecessary worry, or being embarrassed if it turns out to be nothing. Margaret, a 72-year-old living alone in Florida, saw one side of her face drooping in the mirror. She didn't want to bother her neighbor for something so small. She waited until morning to call her daughter, missing the treatment window. This fear of bothering others is powerful, but when it comes to stroke, reaching out might save your life. And sometimes, people don't even know what signs to look for. 7. Not knowing the early signs of a stroke. We often imagine stroke as a dramatic collapse or sudden paralysis, but most strokes begin with subtle signs: a crooked smile, slurred speech, one eye not opening properly. A survey by the CDC found that nearly 1 in 3 adults over 60 didn't know that changes in the face and speech were warning signs of stroke. That's a critical knowledge gap. The earlier you spot a stroke, the better your chances of avoiding long-term damage. It's not about panic, it's about preparation. Unfortunately, even those who suspect something is wrong sometimes choose to wait. 8. Delay in calling for help and guessing what is wrong. Instead of picking up the phone, many people try to rationalize their symptoms. Maybe I just didn't sleep well. Maybe my blood sugar's low. They drink water. Lie down. Wait. According to the National Stroke Institute, nearly 45% of stroke patients arrive at the hospital too late simply because they guessed wrong. There's no replacement for professional help. If something doesn't feel or look right, don't wait. Call. And sadly, in some cases, people can't see the change at all. 9. Not noticing that the face has changed. Some strokes damage the part of the brain responsible for self-awareness. A person might look in the mirror and not see anything unusual. This condition, anosognosia, makes early stroke signs even harder to catch. A 71-year-old man in California felt fine during a video call with his son, but his son noticed the uneven smile and drooping eye. He called for help, and his father was treated in time. Without that call, the stroke could have progressed further. When you can't see the change in yourself, your loved ones become the mirror. But even with all the signs, one belief keeps many people from acting. 10. Not thinking it could happen to them. Perhaps the most dangerous mindset is denial. Many older adults believe they're not the type to have a stroke. They eat healthy, stay active, and take their medication. So when their smile starts to droop, they assume it must be something else. A 64-year-old woman who gardened daily thought her symptoms were just fatigue. She lay down to rest. When she woke up, she had lost the ability to speak. Strokes don't target the weak or the careless. They strike without warning, and unless you act quickly, the consequences can last a lifetime. So if your face feels off, your words sound unclear, or your reflection looks unfamiliar, don't wait. Don't rationalize. Don't be the one who thought, it can't happen to me. Now you know why so many people miss the signs. It's not because they don't care. It's because they never imagined it could happen to them. But the truth is, strokes often begin with small changes in the face. A drooping mouth, one eye not opening the same, a crooked smile, or slightly slurred words. These are not harmless. They are the brain's first cries for help. You don't have to be a doctor to save a life. Just notice the face. If something seems off, act fast. Don't wait. Don't Google. Call 911. Because even a few minutes can make the difference between full recovery and never being able to speak or smile again. If you live alone, print the signs and keep them on your mirror. If you have older loved ones, send them this video. One quick share could save their life. And if you found this helpful, please take a moment to like, share, and subscribe to Senior Health Guide. We're here to give you real, clear advice to protect yourself and the people you love. Your one click could be the reason someone gets help in time. Let's keep each other safe. One face, one life at a time. Subscribe now and join a community that truly cares.